Hello, this is Dr. Chris Marshall here at Medical Specialty Clinic, and today I wanted to talk to you a little bit about dementia. I have patients that ask me about this all the time, and it is a huge fear, I think, for a lot of people, if not most people, really fearful of losing their mind, their mental capacity as they get older. And contrary to popular belief, it is not normal to have dementia as you get older, to have a lot of memory trouble as you get older. Everybody can have a little problem with their memory, but typically doesn't affect their daily life. So it is abnormal to have severe problems with your memory when you get older, and certainly if you're younger. But there are a lot of normal, elderly, 85, 90-year-old people that still have their mental function, can pay their bills, can make decisions, can drive, things like that. That would be normal. Less than that is abnormal. So what is dementia? Dementia is an impairment in mental functioning. This can include memory, ability to reason, make decisions, things like that. So technically an impairment in learning or memory or language. It can be an impairment in what we call executive functioning. That would be decision making, paying bills, things like that. Not being caught by scammers, not being fooled by that kind of thing, being able to catch that. You know, I think people would say you're pretty sharp if you're not fooled by scammers. So being able to be easily fooled, things like that, would be a problem. Attention is another area, so you want to be able to pay attention, and that obviously helps with learning. If you pay attention to things, you're more likely to store those memories. Motor function, even up to walking or being able to reach for things and grab them and hold them. Social isolation is also a problem with dementia, so you don't interact normally with other people. You're not able to pick up on those subtle, unspoken cues of life that we use to interpret what other people are saying to us and trying to communicate with us, things like that. So that would be dementia, some impairment in that functioning. Now that has to be a decline from a previous level. So if you've always been that way, then that's not dementia, that's just the way you are. Also, this can't be caused by another illness. So acute delirium, say someone's given a medication that makes them have these symptoms, you stop the medication, that goes away, that's not dementia, that's delirium. That would be another case. If somebody has, just another example, thyroid problems, thyroid gets out of whack and they have a lot of trouble with their memory or their cognitive abilities, that's caused by another disease. So you treat the underlying disease to improve that. And it has to impair your daily activities. So this is typically in people over age 60. There are several different kinds of dementia. I think obviously Alzheimer's would be the most common form and the most well-known form. And we believe that that is caused by amyloid plaques that build up in the brain that cause damage to the neurons. When we're born, typically we have all the nerve cells that we're ever going to have. So we have all the brain cells that we'll ever have in our life. Now we don't have all the neural connections that we will have in our lifetime, and we can form new connections and improve those connections over time, and that's one of the ways we do that when we learn. And another example would be someone has a stroke and the area of the brain gets damaged. They're able to, with therapy, speech therapy, physical therapy, learning, they're able to form new connections and improve that, even though some areas of the brain were damaged and will not ever come back. So you can form new neural connections to improve that after damage. So dementia can be caused by, Alzheimer's. It can be caused by brain damage, so you can have stroke, which is an acute onset, large area of the brain damaged, or relatively large area of the brain's damaged. You can also have microvascular disease, where over a long period of time, the small blood vessels are damaged by atherosclerosis, where the plaque builds up in the arteries and causes them to clog up, and you don't get adequate nutrition to the areas of the brain, and they slowly atrophy and lose function. So that's microvascular disease or vascular dementia. And then there's what we call frontotemporal dementia, and that's where the frontal lobe of the brain and the temporal lobes get damaged. That typically is much more involved with behaviors. So you have a lot of inappropriate behaviors. So one example of that would be someone who's been very reserved their whole life, and then all of a sudden a man, for example, starts trying to grope women or expose themselves, things like that. Completely atypical behavior for them prior to that. Just saying inappropriate things like that. A complete change in personality at an older age would be a concern for frontotemporal dementia. So another type of dementia would be Lewy body dementia. And Lewy body dementia is another form where proteins get built up in the nerve cells or near the nerve cells and damage them. And this can be found in Lewy body dementia. It can be found in Alzheimer's as well as the amyloid plaques that I mentioned earlier, and then also sometimes in Parkinson's disease it can be found. And so sometimes there's a mixture of these. We're still trying to figure out exactly what causes the dementia and what to do about it. So this is still an area of evolving education and research. So we don't have all the answers here, obviously, or we would have better treatments. And then other diseases also can cause dementia. So Huntington's disease would be one, Parkinson's disease would be another. Several areas of diseases that can cause trouble and lead to dementia, sometimes rather quickly. And then other things like just brain injury, so trauma, head trauma, things like that can cause it. So that's basics on dementia and what it is, and then most people want to know what they can do to prevent it. So some things that are linked to the development of dementia as we age and not due to specific diseases that can be prevented would be, obviously protective factors would be smoking makes dementia worse, so you would not want to smoke. Heavy alcohol use, moderate alcohol use does not seem to be directly linked to it, but heavy alcohol use certainly can cause trouble. Obesity, actually a body mass index over 30, which is not that hard to get, can be linked to dementia. So we think insulin resistance plays a part in that, and that goes along with being overweight, obese, having a high body mass index. So insulin resistance is a problem. And actually some researchers have referred to Alzheimer's dementia as type 3 diabetes, which diabetes is typically insulin resistance, at least type 2. Type 1 is typically onset as a child and you don't make insulin. Type 2 would be insulin resistance. It causes you not to be able to maintain a normal blood sugar. And then type 3, possibly Alzheimer's dementia. That's not my words, that's some newer ways of looking at things. So some interesting areas of research going on there in that. A lower education level. So if you start out less educated, obviously your dementia would be worse than if you start out with a sharper mind to begin with. So you further in school, more educated, things like that, you have more of a reserve, and so that's beneficial. So staying sharp, getting a good education, continuing to exercise the mind, that's protective against dementia. Other diseases, high cholesterol, high blood pressure, things like that are linked with dementia, so you'd want to keep your blood pressure from being elevated. And then high cholesterol causes lots of trouble, not just with the brain, but the heart, the kidneys, things like that. So you want to keep your cholesterol down. You want to eat a healthy diet, maintain really low triglycerides in particular. When we say cholesterol, we usually refer to an entire lipid panel, which is composed of triglycerides, HDL, which is a good cholesterol, and then LDL, which is the quote-unquote bad cholesterol. But triglycerides are really a major factor in that. Another area that can help be protective of against dementia is not being socially isolated. So staying active with communicating with others, staying involved in groups and interacting with other people continuously through the day, that has been shown to be protective. So if you stay home by yourself and you don't have a lot of interactions with other people, that can be a risk factor for dementia. So these are just a few things that you can try to address and see if that can help you prevent dementia for yourself later in life. There seem to be two major mechanisms that cause dementia. So there's what we call neuroinflammation. So just inflammation in the brain and central nervous system can lead to dementia. So anything you can do to decrease inflammation. So maintaining a good healthy diet, not being exposed to a lot of toxins, staying active. So exercise is another area that is protective. So exercise can be very protective for dementia and lots of other diseases as well. So that all kind of goes together. Healthy living, healthy lifestyle is protective, and then just development and maintenance is another mechanism. So if you don't exercise the brain, if you don't use it regularly, then the decline would be quicker. Kind of keep that in mind. All right, so to sum up, dementia typically develops from damage to the brain in some way over time, much more common as we get older. There's several risk factors for that, typically inflammation, plaque buildup, high cholesterol, high blood pressure, toxins like smoking and alcohol, and not exercise in the brain. And then things you can do to help prevent it obviously go back in a lot of ways to those risk factors for it. Exercise, regular exercise is great. Continue to use your mind, interact with other people, do mental exercises like search of words or crossword puzzles, things like that. Kind of stress yourself a little bit. Try to learn something new, learn a new hobby. Always good advice for anybody really, but just good health. And then eat properly, so decrease all the toxins in your diet. Try to eat more natural foods. Vegetables are always great. Decrease the refined sugars and decrease the processed foods if at all possible. Carbohydrates, so decreasing insulin resistance. So low carb, not necessarily extremely low carb like keto or Atkins, but just decreasing the amount of carbohydrates, which is a sugar. Carbohydrates and sugar are essentially the same thing. So sugar is just simple carbohydrates. So maintain a carbohydrate aware diet. So be aware of all the sugars that you get, all the places you get carbohydrates that are hidden in a lot of foods. So potatoes, bread, things made with wheat. So pasta, flour, biscuits, things like that, pancakes, waffles, and then grains and cereals, another big source of carbohydrates. All these things over time increase insulin, and that's pro-inflammatory. So be mindful of that. And all of these processed foods that we eat that are made to sit on a shelf, that have preservatives, things like that. I'm not saying they're terrible, but if you can eat less of those, I think that you'd be better off. Just some things to keep in mind. And also another good tool for helping to delay dementia or prevent the development of dementia is actually intermittent fasting. People really don't know how beneficial fasting is for us. We're not meant to have plenty of resources continuously. We actually do very well when we're tested a little bit with a lack of resources. And by that I mean food. So if we do without food, we maintain very well without food. And you can go back and look at severe cases of this with starvation in the world and concentration camps during World War II, things like that, where people had very little and still survived nutrition-wise. Now there were other reasons for people to die and have other ailments, but as far as nutrition, we do very well with few resources. When we have a limited amount of resources, our bodies work more efficiently. So think about it like during the Great Depression or during times of war in this country in particular, we would have ration books. So you'd only be able to get so many sticks of butter, so much milk, so many canned goods, things like that. So when we do that, when we know we only have so much of this, we use everything we do have more efficiently. We make it last longer. We stretch it. We don't waste. We're much less wasteful. And so our body's the same way. When it knows that there is a limited amount of resources, it runs a little more efficiently and it maintains a much more efficient process. And if there's plenty all the time, it's going to store and waste and build up toxins and things like that. And so some studies have actually shown that fasting can make people live longer and can increase longevity, particularly in animal studies. When they study animals and their nutrition intake, when they have less food and nutrients, those animals actually live longer than the ones who have as much as they can eat. We're no different than other animals in that regard. If we have a finite number of resources, we're going to run a little more efficiently, and that actually will help us live longer and help prevent dementia. So we live longer and healthy to a point. Obviously, you can have too few resources, and that would be true starvation, and then you'd have mineral and vitamin deficiencies, and that can cause trouble. But assuming the basic needs are met, and then there's a finite number of resources, it could really help slow down or prevent dementia. So just a few things to think about. And as always, this is not medical advice. For advice on what to do for you specifically to delay or prevent dementia, please go talk to your individual healthcare provider. So this is not a, there's no doctor-patient relationship here. This is just a video for informational purposes. But if you want to talk to us, come in and see us. We'll be glad to see you here at Medical Specialty Clinic. Just give us a call, 731-257-1500, or you can check us out on our website, www.medspecialtyclinic.com.